Well, for the last 100 years, the international community has been attempting to limit the supply of intoxicating substances to the global community. This has been particularly focused on opioids such as opium, morphine and heroin, and also cocaine and cannabis. By any measurement in terms of supply reduction, this has been a profound failure. Rather than creating a drug-free world, which has been the ambition of the international community, represented first by the League of Nations and then by the United Nations, this has simply not been achieved. In fact, this effort to eliminate drugs from the world has actually caused more harm than good. And the human rights abuses that we have seen associated with this effort to stem the flow of narcotics is really beyond acceptability in terms of contemporary international human rights standards. Because since the end of the Cold War, we've seen a dramatic expansion in the international drug trade, the expansion of the illicit drug economy. And increasingly what we're seeing is that many countries have begun to realise that the old methods of trying to address the drug trade, specifically through supply reduction, has failed, as has strategies of militarising, creating this war on drugs, whereby we really securitise the drugs issue by focusing on support to policing, support to military sectors in order that they can eradicate and interdict drug supplies. Now, a number of countries, most specifically those of Latin America, believe that this completely fails to really address the source of the illicit drug trade. It doesn't address the drivers of demand, which is largely West European and North American countries. And therefore the emphasis of many of these Latin American states is that we really have to adopt a different approach to addressing the level of narcotic drugs that we have in society. And we're seeing an increasing alliance between Latin American countries and West European countries on the need for liberalisation of drug laws, on decriminalisation, and that we have to move towards a more harm reduction focused approach, and an approach which is more rights oriented. And this really contrasts with the position of the United States, Russia, many other countries in Eastern Europe, which retain this idea that we can continue to fight the war on drugs by escalating it. And these tensions are really very, very deep now. We've seen legalisation of cannabis in Uruguay, we're seeing legalisation of drugs in different states of North America. So as a result, we've really got this tension in the drug control model, which means that really the capacity to hold the system together around a global consensus is really no longer viable. The aim of this March meeting is to try and formulate a joint ministerial statement under which all countries agree on the progress that has been made in terms of achieving the objectives of the 2009 political declaration. Now, this looked towards a balanced and integrated approach in addressing drugs. It looked towards emphasising more demand reduction rather than supply-focused eradication. However, as we've seen in recent deliberations at the CND in Vienna, countries have completely contrasting ideas over the level of progress that's been achieved and how far it's possible to maintain this global consensus going forward over the next decade. So really we're looking towards this CND meeting in March as a kind of analysis and experiment for us to understand how far this global consensus can still be maintained. What we're expecting from the March meeting is that a very minimum consensus will emerge, and this really is going to be inadequate in terms of holding countries together as they approach the 2016 Special General Assembly session of the United Nations, where we're going to see a number of countries really pressing for complete revision of the UN treaty system as far as drug control goes.